We'll turn next to Senator King.
Thank you, Mr. Chairman. There's an unspoken theme to this hearing as it has unfolded, and that is implementation is as important as vision. We deal in laws up here, but the majority of what you've been talking about today has been implementation of the laws. We can pass great laws, but if they're not adequately implemented, it ain't going to work. And one of the best examples, Mr. Kanga, you may know about this. 3.5 years ago, we passed a law about domiciliary care at state veterans' homes, and we're still waiting for the regulations. 3.5 years later. And in the meantime, our veterans' homes in Maine are losing something like $3 million a year based upon the lack of having this back payment and the implementation. Tomorrow is the anniversary of D-Day, and I've mentioned this before in this committee. I like to remind people when they tell me how long things are going to take that Eisenhower retook Europe in 11 months. We should not be waiting years for regulations to implement the laws that we pass here. So I hope that can be a theme, Mr. Chairman, of this committee. Not that the VA is, they're bad people or they're trying not to enforce the laws, but somehow we have to break through the delays and the sort of sometimes the nonsensical, such as what you endured, Hannah, implementation, because one of the other themes here is home care is A, preferred, and B, cheaper. We should be encouraging it. Mr. Townsend, I presume you would rather be at home than in a hospital or a nursing home.
That's absolutely correct.
And the care that you're receiving, even at an adequate reimbursement rate, is still a lot cheaper than what it would be in one of those institutions. Isn't that correct?
That's also correct, sir.
My mother used to use the term penny wise and pound foolish. So I guess it must be an English term. In our case, it would be penny wise and dollar foolish. But this is a case where we're nickel and diming on what is a much, much lower cost alternative. Is that not correct? This is the big picture as I see it. Ms. Beck, sure.
Yes, sir. It is. These are human beings, first of all, and as you said, the care in the home is causing, in most cases, better outcomes, whether better health outcomes or better quality of life. And from the perspective of cost savings, the idea, as has been pointed out previously, that the PCAFC program has higher standards to become a part of than the more expensive Homemaker Home Health program.
I appreciate that. I'm going to cut you off because
yes, sir.
We're out of time. I've got this little digital thing that tells me how many seconds I have left. Another example is, Mr. Skanga, the recent CMS rules about staffing ratios. HRSA indicates by next year we'll have a 78,000 nurse shortage in this country, and yet CMS is issuing rules for increasing staffing when there's nobody to hire. And I know in Maine, we're losing 4 nursing homes so far this year, 1 this week. We've lost 26 in the last 10 years because mostly lack of staff. So these well-meaning regulations, nobody's against adequate staffing levels, but the well-meaning regulations will end up with less care if we lose nursing home beds. Mr. Skanga, do you agree?
Well said, Senator King. I think it's a big problem and something we should be looking at nationwide. We think for just skilled nursing facilities alone, we're going to be lacking about 102,000 registered nurses and certified nursing assistants just to meet that.
And just because CMS passes a regulation doesn't mean those nurses are going to magically spring into existence.
That is correct. That is correct.
Let the record show that you said well stated, Mr. King, Senator King. I just want to emphasize that. But this is a very serious problem. I mean, we're losing caregiver, and what compounds it is the caregivers who are staying are being burnt out because they're having to work so many hours. So we really should be, CMS ought to really be talking about how do we surge people into this industry, not requiring staffing levels that are going to end up with not lesser care, but no care for veterans and elderly people throughout the country.
Just one quick example, during the COVID-19 pandemic, I lost 36 caregivers in a single day on September 21st, September 28th, 2021, and that was due to the vaccine mandate. We had to think quick on our feet at the Long Island State Veterans Home. We came up with a new provider caregiver title of unit assistant. These are people who are not certified nursing assistants, but can do many of the tasks of the CNAs, with the exception of toileting and bathing. It was great. It worked out well for us. They made a little bit less than a certified nurse assistant, and we found plenty of people to fill this particular role. The sad part for us as an institution is that we got no credit whatsoever from CMS in terms of the payroll-based journal and the fact that we had an alternate type of caregiver to provide the care, to be the hands-on, to do things like feeding the residents, helping them get dressed, helping make their beds, helping transfer them around the facility. So we were able, as a State Veterans Home program, to come up with the bodies to provide the care, but sadly, CMS did not recognize this kind of caregiver, and when it came to the metrics of providing a certain amount of providers per resident, they were not counted.
I think we should move CMS out of Washington into Poughkeepsie or Bozeman, Montana, or someplace so they know what's actually going on the ground. Thank you, Mr. Chairman.
Thank you, Senator King.